Thank you for joining us today. I want to thank specifically Georgetown and the Global Health Initiative, and especially Maeve, who you'll be meeting in a moment, for welcoming us all today for this timely and important conversation. I am Rupa Dutt. I'm the Executive Director of Women in Global Health. And for those of you who don't know about Women in Global Health, Women in Global Health was founded in 2015 with the values of being a global health movement. We specifically engage all actors from civil society, academia, foundations, governments, multilaterals, and private sector to really advance gender equality in global health leadership. What is one of the really exciting things is this particular conversation is brought to you by the Women in Global Health DC chapter, and you'll be hearing from Nicole. Nicole, if you just want to wave your hand. She is currently the chair of the DC chapter, so if you have any questions about that, she'll be your point person. But the global movement has grown since 2015. We have 8 official chapters around the world, about 25,000 followers and supporters from 90 different countries, and about 20 chapters in the pipeline. So it is a very exciting movement to be a part of, and we really hope that all of you, men, women, and all genders, join the movement and continue to support gender equality. And that's what's really inspired us to really bring this conversation about the intersection of gender, health, and climate to all of you, especially this week after the UN General Assembly. Last week was momentous for global health, the week in which the climate strike took over New York and the world. World leaders met to discuss action on climate change, and also the week in which world leaders met for the very first time to agree on action towards universal health coverage. UN member states adopted the new political declaration on universal health coverage, which calls on countries to take action at home, including dedicating at least 1% incremental increase of their budgets to healthcare. This is also considered the strongest gendered, mainstreamed global health declaration of its time. And the Climate Summit brought a burst of new commitments and initiatives. These included dozens of nations pledging to strengthen their plans under the Paris deal, new commitments to the multilateral Green Climate Fund, asset managers committing to carbon-neutral portfolios by 2050, and specifically renewing the commitment to strengthen the global response to the threat of climate change by keeping a global temperature rise this century well below 2 degrees Celsius, above pre-industrial levels. Moreover, when we hear from multilaterals that are working on health and climate, particularly WHO, has really encouraged us to continue monitoring until the next conference of parties in Chile, and really to make sure that initiatives such as clean air initiatives and commitments made at the Climate Summit are moving. More importantly, Women in Global Health also played a key role as co-conveners with the Alliance of Gender Equality and Universal Health Coverage. We co-convened this alliance of 107 organizations with Women Deliver and the International Women's Health Coalition. With like-minded member states and agencies, we work to ensure that gender equality and women's rights, including sexual and reproductive health and rights, stayed central in the process and central in the Universal Health Coverage political declaration. At the beginning of the negotiations, they were not at the table, but now they're included strongly in the final political declaration. This is truly something to celebrate, and we are proud that the political declaration also recognizes the role of women in the health workforce. 70% of the health workers are women, and for those that might not know, half of what women do in the health sector is unpaid, and that's nearly 1.3 trillion US dollars. So recognizing the critical role women play, and especially the health sector, and recognizing how they're going to be critical to solving the shortage of 18 million health workers needed to deliver UHC, and that language being in the political declaration was a milestone for all women, in particularly the health sector. However, both of these meetings are not without controversy. The United States joined 19 nations, including Saudi Arabia and Russia, to oppose references to sexual and reproductive health and rights. And several of the world's largest nations either did nothing to bring new pledges, including China. They didn't go as far as advocates hoped. So there continues to be a struggle that we must all be mindful of. So today we will focus on walking the talk. How do we continue the momentum of last week and make sustainable change? What next? How do we accelerate action and make sure commitments are implemented? However, there is clearly a gender dimension to this conversation today. We must not forget, when talking about climate and health, these two key messages. One, climate change has a gender vulnerability. Women constitute a majority of the world's poor. They're also more reliant on informal trade and natural resources. They are at great risk to affect both climate change and disasters and climate change aftermaths. The hours that girls are spending on collecting water within climate change, this number is going to continue to increase and keep them out of school. And we can go on about the examples, and we'll be hearing from our panelists later today about some of these gender implications. The second key message really to keep in mind is that gender equality creates resilience in our ecosystems. Women are change makers. Let's not paint them as vulnerable people, but also the drivers of health and resilience in our communities. They do make up 50% of the global population, but they also serve as change makers and leaders in climate change, adaptation, and mitigation. So let's continue to engage women in decision-making for climate change and really think about the gender considerations. Specifically, today we are going to be focusing on highlighting best practices, what's working now, what needs to be taken to scale. By focusing on the intersection of health, climate change, and gender, we hope to underscore how collective action is a force of multiplier. Action towards one sustainable goal can be beneficial to other. We're actually going to be now turning to our first keynote. We want to directly hear a report from a convening of organizations and individual advocates for climate mitigation, adaptation, and better health, led by Global Climate and Health Alliance, the Global Health Council, Action for Global Health UK, Foundation for Climate Restoration, the Wellcome Trust, and the Jope Lang Institute. They met to promote dialogue between these distinct communities, identify common interests and agendas, and explore synergies and areas for future collaboration. On that note, I'd like to welcome Dr. Paul Zietz, who is a physician, epidemiologist, tenacious award-winning advocate for global justice as well as human rights. He has dedicated his career to catalyzing large-scale movements with global impacts. Dr. Zietz is currently the Senior Policy Advisor at the Foundation of Climate Restoration and the founder of Build a Movement 2020. Welcome, Dr. Zietz.
Good afternoon, everyone. Thank you so much for having me here. I'm so excited about the Women in Global Health movement. I had no idea it was so vast and expansive right now, 20 more chapters coming. It couldn't be a day too soon, so thank you for that work in mobilizing women, and I'm glad to hear men can also be supporters of that. I didn't know I could sign up for it. I was always feeling a little envy about it, yeah. So how many people were up at Unga last week or were aware of it? Okay, many of us are at least aware of it. I was up there for 11 days. That was the longest I ever survived in an Unga. I don't recommend it. I usually have a 3 to 4 day max. But we all felt like it was an important opportunity to take a step forward, but also reflect about where we're going. And I think the day after the Climate Action Summit, which was on Monday the 23rd, and there was also the Universal Healthcare high-level meeting on the 23rd. They were sort of overlapping. And so the next morning, on Tuesday morning, the 24th, I had the honor to be part of a convening of global health and global climate action stakeholders. And we were really looking at it from the advocacy perspective. And trying to bring these worlds together. So Christoph Ben, who many of you may know, was the Director of External Relations at the Global Fund for 15 or more years. And he, last year, went over to the Jope Lang Institute, and he helped convene this meeting. We don't have a formal report out yet, but as soon as we do, I will send it to you all so you can share it with your whole network. It was an initial kind of kickoff meeting. It was a space where discussion could be open and the challenges could be addressed. So I don't have the magic solution about how to advocate going forward on this. But I do want to share with you, first of all, it was exciting to learn that there are so many organizations already operational around global climate and health. There are civic groups. Christoph was able to also bring together about 50 civil society organizations from around the world, although I will say, I think we all acknowledge that it was mostly global north. It was global north heavy, and that was a weakness of the meeting. But he was able to bring together representatives of the international global architecture. And that was a unique moment. And actually, I don't think they had all ever been in the same room before together. It was the Green Climate Fund, the Global Fund to Fight AIDS, TB, and Malaria, the Global Partnership for Education, WHO, which has a climate program for the last 20 years. I think most of the room never heard about it and didn't know about it. So that was sort of like new, that was a news flash. Gavi was there, the World Bank was there, et cetera. So it was a really interesting opportunity to really look about, from the global architecture perspective, what everyone was thinking, and actually getting them to think together about what the challenges that we face are. So I'm going to start with sort of some bad news kind of perspectives. This is like a little bit of my own kind of perspective versus and what occurred at the meeting. So I'm like weaving that together, if you could bear with me. I had the opportunity to attend the Secretary General's SDG Advocates session on the Sunday night before these two big meetings, on the night before the 23rd, on the 22nd. He was very animated, and he said to the community gathered there that if we keep going this is the night before these two summits, right? So he knew what the outcomes were going to be. And he said, if we keep going at the pace that we're going, we're only going to get halfway to the Paris climate goals, and we're only going to get halfway to the SDGs. It was sort of sobering. It was refreshing that he was so honest, but it was sort of sobering. But for me, it was also like, wait a second, I was here last year at the same reception, and he said the exact same thing. So I just want us to like really take that to heart about like, if we keep doing the same thing over and over again, we're going to end up there next year, and he's going to say the same exact thing again. I mean, that's my fear, maybe. So we have to really, and that was really the pretext of this meeting on the morning after these two summits, was the climate emergency is so severe and so troubling, and so we have crossed the tipping points. We're already in the climate emergency, and we don't actually know how fast or what the severity of the changes are going to be. You know why? Because we're at 415 parts per million of CO2 in the atmosphere right now, climbing steadily towards 450 parts per million, and humans have never been alive when CO2 in the atmosphere has been that high. Human society, human evolution, all of our ancestors lived in an environment where it was 300 parts per million or lower. And so we're all learning by experiencing this kind of changing atmosphere. And I think Christophe Ben opened up the meeting with a very clear statement that all of our gains that we've made, and many of us have worked together on global health and global AIDS and the MDG era. Now we're 4 years into the SDG era, and all of the gains against poverty, on reducing poverty, and on the progress we've made on global health is being threatened now. And we have to really think about that. Like, we can't just keep going same old, same old. From an advocacy perspective, the global institutions, as they went down the panel, each of them has some kind of fundraising initiative that they're underway. The Global Fund has its replenishment, I think, this month. The Global Partnership for Education really brought forward the gender equality and the urgent need for education, and that's another element of this that they would have wanted to be in here, the imperative for universal access to education, especially for girls. They're having a big replenishment meeting in 2020, I believe. The Green Climate Fund is undergoing a replenishment process right now. They, during the Global Climate Action Summit, I think they said that they had $7.6 billion of new commitments for their next phase of work, but their formal replenishment conference is going to be held in France sometime in November. Now, you may remember that Secretary Clinton, when she was Secretary of State, announced the Green Climate Fund as a $100 billion per year fund. So now we're in the second phase of replenishment, and the goal is trying to climb back up to 10 billion. So it's like, I won't say what I'm thinking, but you know what I'm saying. What is going on out here? In the face of the emergency, the level of ambition is not matching the challenge. One of the most interesting tidbits at the meeting that I was like, it woke me up from my kind of slumber that I was in that morning, was that the Green Climate Fund reported that 85% of country nationally determined commitments include a human health perspective on the climate emergency. So the countries that have developed the plans, basically in response, based on the Paris Climate Accord, most of them have identified the health impact, the implications of human health, both of the direct effects, the urgent needs for adaptation, and so forth. But the Green Climate Fund reported, I think, that less than 10%, maybe even 7% of proposals that they're receiving include a health perspective. So that was like, wow, that's like a pot of gold that the global health community could maybe access and maybe help develop proposals on. The Green Climate Fund called it the missing middle. So they have these commitments for global health and gender issues in the nationally determined commitments that the country plans are, but the proposals that are actually coming to the Green Climate Fund don't have that in there. So that's what they call the missing middle. There was a really other kind of, it was discussed somewhat during the meeting, but us in the global health movement, we've had some success, right? The global AIDS movement, Women Deliver, all the things that we are all part of. We've seen issues that were orphaned become prominent, and we've seen progress made. We've seen billions of dollars mobilized. We've seen new institutions come forward and really do what everyone said was impossible. We've made the impossible possible, and we've made some significant progress. So there was a lot of people in the room, sort of like me, that were, I'm a public health physician, but I've leaped over into the climate space. There was Robin Gorna from DFID was there. Folks from Health Gap Coalition were there, David Barr and others from the AIDS movement. Christoph Ben, who was like worked on AIDS, TB, and malaria, was there for many decades, leading that effort, and now he's also kind of navigating the climate space. Jamie Drummond, who helped founded the One campaign, was there, and he's exploring this link between gender, health, and climate. So I think a lot of us in the who have been in the zone of the gender and health movements are also now trying to figure out how to navigate the climate movements and the climate space. So I think that was interesting. And apparently there are some foundations that are actually wanting to study that and wanting to learn what were the lessons learned. How did the global health movement ensure participation of affected communities? How did we ensure gender issues and human rights issues were taking forward as we've gone to scale? And that's an opportunity and a challenge for the climate movement, which they really haven't cracked that nut yet, if you think about it that way. So we did talk a little bit about, global advocacy. The Green Climate Fund, surprisingly, doesn't have a civil society or a global network of stakeholders that are actually watchdogging it, holding it accountable, and also fundraising for it. So we all know that there's a large global network of stakeholders that work on Women Deliver and are working on global health, like holding the Global Fund accountable. We have representation on the board, for example. Civil society has 3 board seats, 2 minutes left. And so we also have the Global Fund Advocates Network now, which is a network that has matured over the last 15 years into being a real force of nature and keeping the Global Fund vibrant and dynamic and fully funded. So guess what? The Green Climate Fund doesn't have that yet. So I think that's something that they're exploring. They're working on their civic engagement strategy. And I think we all in this room and online here have an opportunity to become the first wave of stakeholders that really try to figure out how to optimize, our experience and our perspectives and bring that forward into the Green Climate Fund. The last thing I'll mention, and then I'll stop, is that Rick Parnell, who's the CEO of the Foundation for Climate Restoration, also spoke on this panel of organizations, and that's the work that I'm doing right now. We, and Christoph Ben and others, we introduced this idea that there are 3 legs of climate action. We know about adaptation, We know about mitigation, which is reducing emissions. The third leg of the stool is what we're calling climate restoration. And that is focused on removing the 1,000 gigatons of CO2 that we've already pumped up into the atmosphere, the damage that's already been done. And it's also focusing on Arctic ice restoration, which is an urgent imperative so that we can keep the frozen methane in the Arctic permafrost so that the feedback loops don't get worse. So I offer this idea of restoration, adaptation, and mitigation, and this was discussed at the meeting, RAM, we say, not RAM, RAM, restoration, adaptation, mitigation as a new way of thinking about climate action going forward. And it's a hopeful message. If we can restore a safe and healthy climate for future generations, then we can ensure the survival and flourishing of humanity. And we did discuss briefly, and then I'll stop, about, in our health movement, we focused on saving lives or gender equality. We had a kind of connective tissue that brought the movement together. Like the AIDS movement was saving lives. So can we think of something? Can we explore how to create a connective tissue that can connect the global gender equality, health, education, and climate movements? Something like we're committed to the survival and flourishing of humanity, that we can figure out ways to all work together. Thank you.
Okay, great. I think you guys can hear me, otherwise I can be a bit louder. There's a microphone there. Fantastic. Dr. Zeitz, Paul, thank you for such an insightful opening to this session. I think very humbling for us to hear that if we don't start doing things differently, we're only going to make it halfway, and halfway is definitely not good enough in this time period, that it's already a climate emergency, and that taking action is no longer an option. But I think you also really laid out, and what this next panelist challenge is really going to be, to really think about where are the opportunities, how are we going to build this cohesive narrative, not be in silos, work together collectively, and really also bring that spirit of movements. And I can say that as you were talking about the journeys of health movements, how much has been achieved through that. One of the things that I was previewed at last week was hearing the former president of Ireland, Mary Robinson. She's also the chair of the elders and has had a very distinguished career, but really talking about how women's movements, but also I think more broadly than women's movements, just overall movements that are looking at things from a more intersectional perspective can really contribute and be the catalyst for achieving the health and climate agenda we're hoping to. So on this note, I'd like to we're going to be screening. The panelists are already on stage, and I'll be welcoming them in a moment, but we are going to actually turn to the screen, and hopefully you can see what's behind us. We're going to be enjoying a short video from the Nature Conservancy, the Unga project, pronounced Tunagane. Thanks. Tunai.
Tungane.
Thank you. Pronunciation is one of my weaknesses. Thanks. Which is Kiswahili for Let's Unite. It is a video that is a collaboration between the Nature Conservancy and Pathfinder International. It expresses a designed to create integrated solutions to create healthier families, fisheries, and forests in Western Tanzania.
The only way to get to this village in remote western Tanzania is a long boat ride across Lake Tanganyika, the world's longest lake, and almost a mile deep. The village sits at the feet of the Mahale Mountains, where the steep tropical forests are home to East Africa's largest chimpanzee troop. Lake Tanganyika holds more fresh water than Lake Michigan, Lake Superior, and Lake Ontario combined. Evolving in isolation, the lake's unique species include freshwater jellyfish, sponges, and more than 200 species of cichlid fish. There are few places at this scale left in the world for conservation. A largely intact ecosystem with a globally significant cache of species, where we still have the chance to get it right before the scale tips. But imagine you're a woman living on the lake's isolated shore. To provide for your 6 children, your husband fishes in the lake while you farm a small plot of land near the forest. But recently, fish stocks have been declining. This area has one of the highest birth rates in the world. So more and more fish are being hauled out of the lake with destructive fishing gear to feed the growing villages. And more forest is cleared for farming, sending sediment washing into fish breeding sites. To solve these intermingled challenges, the Nature Conservancy, Frankfurt Zoological Society, and reproductive healthcare organization Pathfinder International took partnership a transformative step forward in 2011 with the launch of a project called Tuungane, which means let's unite in Swahili. Already we're helping to bring back the declining fish populations by providing training and better equipment. Conservancy scientists are mapping fish breeding areas and helping communities to designate no-take zones. And we're reducing the pressure on the lake by providing hundreds of people with family planning care, education, microfinance projects, and more. We launched Tuungane project with an eye from the very start towards scaling up across the entire lake basin. We sustain some 12 million people in the 4 countries that border the lake. To pull this off, we're drawing on expertise forged over decades by TNC's U.S. Great Lakes Program and other whole system freshwater projects. And we're working with a basin-wide conservation coalition that includes leading institutions like the John D. and Catherine T. MacArthur Foundation, linking up freshwater conservation and human development efforts and investments creates enormous opportunities to accelerate meaningful impact at the system scale as we address what matters most to nature and people. That's the promise of Lake Tanganyika and Tuungane.
First turn to Cara Hahn. You are a senior technical advisor for population, health, and environment at Pathfinder International. Since its founding for 60 years, Pathfinder International has been using a community-focused model to deliver sexual and reproductive health and rights around the world. Before we get into the nitty-gritty, really want to first begin by really asking you the question, so what is the population, health, and environment framework?
Thank you. I'm really pleased to be here and to be on this esteemed panel and get to hear a little bit more about Unga. I didn't get to attend Unga. So population, health, and environment, I can see some familiar faces in the audience, so I know some of you have heard this for years. It's been around for at least 10 or 20 years, depending on how you define it. In the early days, it used to be known as population and environment. I like to say that it is both an approach and a social movement. Not everyone uses that language, but the reason I say that, I'll start with the approach. As I see it, the approach is integration of sexual and reproductive health and rights, or for some organizations, it's really focused on that voluntary family planning and reproductive health with natural resources management and biodiversity conservation. And as the approach has evolved over the years, it always these days will include certain key aspects of health, including always water, sanitation, and hygiene to some level, and then a variety of other maternal and child health interventions, including sometimes HIV and other targeted interventions. And it will always include alternative livelihoods specifically focused on women and youth and natural resource management groups. So, and as a social movement, I call it that because really people like me, it's a very unsexy term, population, health, environment. We've looked for a better name, as you said. Wouldn't it be great if we had a cohesive term to describe what we're trying to do? For folks like me and those who have substantially funded this kind of work, it is really about making sure that sexual and reproductive health and rights is recognized as a critical component to addressing natural resources management and biodiversity conservation and keeping it as part of the broader gender movement within those spaces, if you will. It has come and emanated, however, also from the development and the environment sector.
Great. So, Cara, thanks for providing us that definition, and I think that's a really, really great way to frame it. So tell us about what we saw in the video. I mean, what a fascinating example, also building on not only local knowledge, but really connecting, global ecosystems. Tell us more about what's happening in the region.
Okay, I'm sure some of you are familiar with the Tanzanian context. It does have one of the highest population growth rates in the world, and many sources will tell you the economic growth of Tanzania, unfortunately, is not keeping up with the rate of change that Tanzania is experiencing, and almost half of the population is under the age of 15. And when you go out to Western Tanzania, you see that population of youth reflected there as well. It's very similar demographic in that way. But what you also see is the birth rate in this area. For example, the average number of births per woman is about 6.7 in this region, as compared to rural Tanzania at only 5.2. So we're talking about an incredibly high birth rate, not a lot of economic opportunities, and with respect to climate change, about 25 to 40% of the protein that folks are getting in their daily diet is coming from fisheries, and yet the fishery is slowly collapsing and declining because of raising temperatures.
Yeah. Cara, can you also put it into context? What is the birth rate in other places in the world?
I might even ask for others to help me out with that. I'm not so good with my just flying statistics off the top, but it is among the highest in the entire world, and I don't know if anybody wants to. Is there anyone who's great with their statistics on growth rates? I'm looking at Laura over there from Population Reference Bureau. Anybody want to? But anyway,
I think it's
yeah.
Is that in high-income countries?
What's that? 2%?
Yeah.
Yes, or yeah. Oh, in high-income countries. Yes, I was going to say it's around 3.1% though in Tanzania, so it's very, very high.
All right.
Yeah.
Continue on to tell us a bit more about the program.
Sure. So one of the ways that these types of programs work, and Gani is a good example of what happens in a lot of these different kinds of integrated programs. You would have an organization like ours partnering with a biodiversity conservation organization. We are a reproductive health organization that works in a whole suite of different health issues, typically. So it's a non-traditional partnership. And we engage with the Ministry of Health actors, the district health offices, always in these places to deliver services and provide capacity building and support otherwise. So we would work on improving the health facilities, the actual facilities themselves, ensuring the capacity of the health workers, especially in key core areas related to maternal child health, and ensuring that they are educated and are able to deliver a wide variety of contraceptive methods. We also always would have community health workers that would be a key component of these kinds of approaches, and they play a very important role in the integration. So community health workers would have a suite of tools that they've been introduced to that are not only focused on health and household health, but they're also focused on environmental issues, such as educating households on how to build a kitchen garden, how to do good composting, the importance of latrines, hand washing, and a whole array of other issues. And we also have two elements I really want to highlight that have worked very well under these programs with Pathfinder, and it's one of the reasons we've been able to scale up this work across the region. One is what we call model households. I'm not saying that this has to be done in any kind of integrated program, but it's been a wonderful, tangible way for communities to wrap their heads around what does it look like to integrate and to do this efficiently, and then what are we trying to achieve in the space of integration. So I know we have someone here talking about fuel-saving stoves. That's a key feature of what we call a model household. But I want to help you visualize it for a moment, because it speaks to everything we're trying to do here and have this cohesive whole. You have a household that has agreed to champion a whole variety of health and environment issues. And it starts with, you must have a latrine and a hand washing station. That's critical, because we all know as public health practitioners that water, sanitation, and hygiene is fundamental, or we won't achieve anything. And then you have, the household also has to be willing to champion improved access to family planning and make referrals not only for family planning, but also for a whole array of health issues that are of high priority to the community. And again, they don't have to be users, of course, but they need to be willing to champion those issues. And then, and that can include girls' education. They always have to have a fuel-saving stove that they are trying to use regularly. It comes with a lot of challenges. And then they would also be addressing a lot of other environmental issues on their plot of land that really, to make a bigger impact, need to go to scale, but do give that household a variety of different ways to support themselves. And then the other way that these projects have worked, another important component, is the work on climate-smart agriculture, working with community groups and other natural resource management groups, and ensuring, as we talk about gender and climate, that women are brought into these groups. They're given both economic power and they're given actual seats at the table to have their voices heard in these groups. And often we are really the activator for that. The policies are in place. In Tanzania, you often see 30% quotas for women's participation, for example, in groups working on land to tenure issues or beach management units, but women don't actually either really sit at the table or don't have a voice at the table. And I think I will leave it there. I could talk about some impacts, but I think the video did a nice job of talking about that, or we can leave it for Q&A.
Great, thanks, Cara. And I think you just really, you said a lot of really great ways of how looking at things from a multi-sectorial perspective, making it about the health, about the climate, environment, gender. So I think that was a really concrete way. And I'd like to turn to Maeve McKean, who is the Executive Director of the Georgetown Global Health Initiative. Your program serves as a university-wide platform for supporting research, teaching service, and also developing concrete solutions to the health challenges facing families and communities throughout the world. What's really exciting is that for the academic year of 2019 and 2020, for those of you that don't know, the Global Health Initiative will focus on the global health implications of climate change. So why did you select this particular issue?
So thank you so much. Thank you for coming to Georgetown, everyone. This is a great conversation and really just reflects the interdisciplinary need, the need to address health from an interdisciplinary approach. I think the examples you gave about we're looking at health and climate change, and we have to look at sexual reproductive health and rights. We have to look at biodiversity issues. We have to look at the sort of clean cook stoves, and so if you're and at WASH, and that if you're interested in climate, if you're interested in health, there are so many different ways to use those skills. And so the Global Health Initiative at Georgetown is really I describe it as the way to bring all the different Georgetown programs together. So our university has an enormous footprint in global health as it relates to policy, as it relates to social justice. And we come at that from different angles, from the medical center, from the law center, from the School of Public Policy, from the School of the Foreign Service. And so when we were looking at having a theme for the year, we wanted to choose a theme that sort of brought in those strengths of what Georgetown brings to the conversation, and also what are the most crucial issues today. And so Dr. Paul Zeitz, when he was speaking about earlier about how important this issue of climate change is now and how critical it is. And so, as many know, the World Health Organization named climate change as one of the top 10 threats to global health this year, and something that needs to be addressed. And when we think of global, even though we're sitting here in Washington, D.C., we don't mean that things that are happening outside the borders that we need to work on. We really, the United States is part of the globe. And so another reason that we really chose climate change is because to anyone at Georgetown or in Washington or around the world who's interested in issues of global health, you really need to look in your own backyard and what you should be doing, both as an individual and as part of your engagement with your government. And I would just say one more thing, which is climate change, this event on climate and gender and health. Gender is one important and critical issue and viewpoint of which we look at climate. That the issues of the degradation of our planet are disproportionately affecting women because of a number of inequalities that we can talk about on a different panel. But it's just, there'll be subsequent panels that we sort of look at climate change from other really important angles. Each will hopefully give another piece of the puzzle of what we should each be doing.
Great, thanks, Maeve, and great leadership here to think about it that way. And often we hear gender as a competing interest, but what's really nice is that as we've been talking about it already today, gender is seen as a cross-cutting issue. So let's continue to do that discussion. And I'd like to turn actually to Jem Porcaro. You are the lead energy access specialist at Sustainable Energy for All. Your organization was launched by the then Secretary General of the United Nations, Ban Ki-moon, to help mobilize the achievement of universal energy access, improve energy efficiency, and increase the use of renewable energy. Can you really begin by telling us what was the vision around Sustainable Development Goal 7?
Is this on? Yeah, so SDG 7 was one of 17 SDGs that were adopted in 2015, as we all know, as part of a framework for how the world would achieve peace and prosperity. And I think at the core of SDG 7 is an acknowledgement that we need to transition to a cleaner as well as a more equitable energy system. That on the one hand helps us avoid the worst impacts of climate change, but on the other hand, help us achieve all of the other sustainable development goals. And so in many ways, as the previous SG has mentioned, sustainable energy is the golden thread that weaves across all of the other SDGs. It's this critical input that we need in order to achieve all of the other, whether it's health, gender, poverty reduction, education, so on and so forth. So under SDG 7, I'm sure many of you don't know the specifics, but there are 3 specific targets. The first of which is ensuring access, universal access to modern energy services by 2030. What does this mean? Why is it important? There's roughly 3 billion people around the world who today rely on solid biomass like wood, dung, charcoal to cook their meals. We'll say more about this in a second. There's almost 1 billion people who live in the dark, who don't have power, don't have electricity, all the things that we take for granted. That's energy poverty. So one of the goals is to address that challenge, and we'll talk more about kind of the gender health implications of that in a moment. The other 2 targets are around being much more ambitious around the adoption of renewable energy and energy efficiency. And so that's basically what SDG 7 is all about. And the significance of SDG 7 is that it was the first time that the international development community officially recognized the importance and the role of energy in the development discourse, in the development agenda. For those of you who might have been around or working on the Millennium Development Goals, it was a notable absence there. Partly because, or not partly, in large part due to some political failures or inabilities to actually get energy within the development agenda. So it's a huge win now to have this big mandate around sustainable energy that both is connected to the climate agenda as well as the broader sustainable development agenda, which obviously has a huge health and gender angle to it. So that's kind of what SDG 7 is all about. And that really is kind of what we at Sustainable Energy for All, as you mentioned, it's the foundation of our work. Our mission is to grow and build a movement around sustainable energy, but not to work in isolation. Our role is to say, how do we enable the achievement of SDG 3, all the other SDGs?
Great, thanks a lot, Jem. And I think you really did break down SDG 7, which not everybody knows. I learned a lot about this, especially the level of impact, 3 billion, 1 billion, poverty, and also just really putting that contrast between the MDGs and SDGs and why SDGs are really seen as the bold vision. So energy being a key component of that. So I'd like to turn to Davina van der Slaan, who is the chief. I tried. Is the Chief Executive Officer of the Clean Cooking Alliance. The Clean Cooking Alliance works with a global network of partners to build an inclusive industry that makes clean cooking accessible to the 3 billion people who live each day without it. It was established in 2010. The Alliance is driving consumer demand, mobilizing investments to build a pipeline of scalable businesses, and fostering an enabling environment that allows the sector to thrive. So a lot going on there. Davina, we've started to hear trickles of mention about the role women play and really being change agents. So how do women play a crucial role in the widespread adoption and use of a cleaner, more modern household cooking solution?
Great, thank you. Wonderful to be here. My name is Dimfna van der Lans, which I realize is a very Dutch name, and I am indeed from the Netherlands originally. So wonderful to be here. I'm already very pleased with additional connections that I've made today and would love to continue a conversation specifically around how we can integrate more efficiently and effectively household energy solutions in some of the programs that you are working on, because indeed, if it's just my organization trying to do it, it's never going to get done. And so we humbly seek out partnerships, unusual as they may be, to make sure that we indeed reach the goal of universal access to clean cooking solutions by 2030. I think a couple of things to point out and to highlight for people here is that the impact of the number that was shared earlier about the 3 billion people who don't have access to a clean cooking solution disproportionately falls on women and children. That's it. That's the reason why I do my job every single day and why I get up. And so if you think about the fact that very often when these conversations happen about impacts on families, water is shown as an example of how much time families and specifically mothers and children have to spend on collecting water. The picture would be even more powerful if there's then also the wood that they will have to collect at the exact same time, sometimes walking up to 7 hours a day to collect just essential inputs to provide for their families. To me, it is totally unacceptable that in a day where I can get a message from my fridge that says, Dimfna, you're running out of milk, which the Dutch people drink a lot of milk, I admit. So I get a lot of those messages. And we have self-driving cars, that there's still families out there who have to cook their meals and provide for their children over open fires, by which they're slowly harming their own health, but also the health of the babies and the children who are very often, just like ours, spending time with their mothers when they're cooking. And so those impacts on their health, and we can talk a little bit more about that, are really incredibly horrific when you think about it. And so every year, indoor air pollution contributes to about 4 million premature deaths. 4 million every year, more than HIV, tuberculosis, and other major diseases combined. And it's a staggering number and one that doesn't really get mentioned very often. And so my organization really tries to make sure that the pictures include wood and firewood so that we can continue to make sure that policymakers and investment funds are thinking about this in the correct way, but also to make sure that we start to think about the solutions. And so I really wanted to pick up on the point that the professor made earlier and your observations about I can be sitting here again in a couple of years and have the exact same conversation with all of you, which is not acceptable to me either. And so if we want to change that narrative, we really, as the Alliance, have to change that narrative within my sector. And so increasingly working with every other organization that works in this space to start creating an exit strategy. I fundamentally believe that if you don't create and design towards the exit, in other words, by 2030, my organization no longer exists. It should be out of a job, and everybody who works for my organization knows this already. And if I don't design for that, then for sure, this problem will not be addressed. And I'm not naive. I don't think it will universal and access are two very difficult words. But if I don't have that intention and I don't put forward what that narrative would be to actually get to those solutions, then it really is never going to happen. And I think that comes back to making sure that we reach those families, the women and the children who are really impacted by not having access to clean cooking solutions, and a deep desire to make sure that that global issue is addressed at the scale that's required.
Great. Denfa, we can really sense the urgency, and I think it's, commendable that you are talking about exit when we still are talking about how we don't know how to get the job done in time. So I think that is a very, very brave and bold point, but also, just kind of highlighting the intersections of, when girls and women are doing household chores and having to spend 7 to 8 hours of their day to collect wood, not getting energy, as was talked about in SDG 7. They're also not going into education, and then we also know that that just leads to greater poverty. So, one of the things that Clean Cooking Alliance is currently doing is redesigning its gender strategy, really to better optimize its role and strengthening the ecosystem for women in the sector. Can you tell us a little bit more about that and how the Alliance plans to engage with gender moving forward, but really also just what are some things that all of us in this room, what are some takeaways we can take from, your process that we should be factoring into our own strategies?
Great, thank you. I'm going to do something unusual, which is actually asking the expert to answer that question, which in this case is Jacinta, who's here with me, and the gender manager. So I'll just stand up and give my seat to her.
Okay, well, this is different.
And Jacinta, do you mind introducing yourself?
So my name is Jacinta Zebige, so I work at the Clean Cooking Alliance, managing our gender and women's empowerment portfolio. And so one thing that we've really been intentional about is how can we better refine and optimize our role in the sector? I think recognizing that we've been in the space for the last 10 years and the space has grown and evolved in sort of multifarious ways. And so how can we be more reflective and responsive in a much more efficient manner, especially when we think about sort of gender and women's empowerment initiatives. And so at the heart of the Alliance, we employ market development sort of tactics to the work that we're doing. So as you mentioned, sort of mobilizing category level demand, creating an investable pipeline of businesses. And so one thing we really want to shift towards as it relates to sort of implementing genders is really embedding gender at the heart of all of those activities. So instead of sort of positioning gender as a standalone initiative, to what extent can we better embed this across all of our market development activities? So for example, when we're thinking about starting an investment facility, can we develop a gender lens investing strategy? When we're working with businesses to identify business challenges, can we co-create solutions that are also gender responsive? And so these are the different tactics that we're really seeking to build out. And I think what's really fundamental to this is also, like Difna was saying, we at the Alliance, we're not going to single-handedly provide universal access to clean cooking. And so what's been a really fundamental part of our gender strategy process is partner consultations. So we've been having meetings with investors, with enterprises, with NGOs, with academics, with researchers, within the clean cooking and outside of the clean cooking, to really think about what are learnings that we should adapt, how are ways that we can work in a much more collaborative, integrated manner that really yields a shared vision, but that still fits within the Alliance's comparative advantage. So that's what we're seeking to build. We're hoping to have the strategy finalized by the end of the year, and really hoping this will kind of be our operational compass forward as it relates to gender.
Great. Wait, you're not going to go yet. Not so easy. Wow, that's amazing. I feel like that just deserves a round of applause there. And just how you began explaining what your organization's doing and what you were doing as a driver of this is really making gender at the center. How did you convince your organization? I mean, I know it's a collective effort because that that's very different from the broad mandate. But how did you really bring that cultural change? And you can tag team together if you'd like, because I think it's important to have that. But I'd love to hear from you.
Yeah, so I would say that this is definitely a work in progress, but I think what helps is really having the political will from above. So this is something that Dymphna really sort of employs across all of our meetings, that gender is at the heart of it. So I think first and foremost, having that political will from senior leadership helps to sort of set the stage. I think one thing that we're also seeking to do is to develop specific mandates for all our teams, because oftentimes when we think about or even just talk about embedding gender, it's like, what does that look like? Like, what does that actually mean for me on the comms team or for me from the private sector team? So that's one thing that we're really going to seek to do, is provide direct mandates for, as it relates to sort of embedding gender, these are the menu of options that we can sort of present to you that you guys can easily adopt. Another idea that we're thinking about also is having an internal gender working group. So this would be essentially representative of individuals from across the team and would really sort of carry out the mandate of not only just sort of integrating gender, but also being able to hear real-time feedback around how is this actually working? Are there better ways that we can adapt this? Is this something that we should continue doing? Like, how can we tweak this? So I think through some of those different approaches, hoping to be able to really institute internally, like much more sort of political will and also just a baseline understanding of what we actually mean. Because I think sometimes it can sit in the world of theory and we need to really move it towards like practical implementation. So that's what we're seeking to do.
Great, fantastic. And I think that really just brings it, brings it home and makes it operational both in your internal engagement, but also your external. So thank you for coming on up and sharing that. So Jem, I'm actually going to turn to you. So during UNGA Week, I took note of something that Mary Robinson, the Elders Chair, had said. The first woman president of Ireland, she's also a former UN High Commissioner of the Human Rights, she boldly declared, climate change is a man-made problem which requires a feminist solution. Tell us about what evidence exists in the interactions between energy, access, and gender, and where you see opportunity.
I actually heard that, and I thought that was fantastic. I think as you're hearing, energy poverty, if it were to have a face, it would have the face of a woman. And I can't stress that enough. As you look at all the various facets of energy poverty, in one way or another, there's a huge gender element to it. So Dimphna mentioned the burden that air pollution is putting on women and children. 4 million people dying every year prematurely from indoor air pollution. Roughly another 4 million are dying from outdoor air pollution, which is caused mostly from our fossil fuel-driven energy systems. That's a huge, huge health burden. Another one, which touched on, which is something that we at SC for All work on, is about 3 out of 4 health facilities in sub-Saharan Africa lack access to reliable power. So imagine if you're a pregnant woman, you go in labor in the middle of the night, show up to your nearest health clinic, which, by the way, might be a 45-minute walk, only to find that the health clinic is in dark, pitch dark. And you're asked and tasked to bring your own kerosene lamp or candle to light your pregnancy and your labor. That is the situation that far too many women are facing every single day. That just underscores kind of all the different gender elements of this issue. And so what we're trying to do through our work is shine a light on this issue. Not many people are even aware of this. And it kind of goes back to what was being said around kind of putting a gender lens through all that we work on. So when it comes to energy planning, for example, one has to ask, whose energy needs are we actually asking? Are we including women as part of who we're asking? Because if we did, I'm sure those issues in terms of the lack of power in a maternity would come up versus if you ask somebody else.
And Jem, as you were just talking about who is really, part of the decision-making table, and in the energy field, as in the health sector, we know that 70% of the workforce, but when we look at top leadership, it's only 25% of the roles. I know, I can say confidently, energy is probably, quite similar numbers. What opportunity do you see to really make sure women are in decision-making roles in driving the agenda in energy?
It's a fantastic point, and if anything, it's probably worse in the energy sector, given how traditional and conservative that sector has been. So women's participation in leadership roles, whether it be boards, leadership within large companies as well as SMEs is critical to changing this. And so much of what we're doing is trying, and the other kind of issue here is that, as someone pointed out earlier on, much of women's activities in the informal sector. So their access to more formal forms of capital financing is much lower than their male counterparts. And so what we're trying to do is empower women, try to provide them access to the tools, the resources, the roles that are necessary. And this is not just, to your earlier point, this is not just a check the box kind of exercise. There have been numerous studies that illustrate the positive impact, both socioeconomic and economic, in empowering women, making sure that women have due representation in these kind of leadership roles. So that's an absolutely critical point.
Great, and yes, I'm just going to say one quick thing. Actually, go for it. We're almost at 5 minutes. So, no, please go ahead, make a quick intervention.
Yeah, I was just going to say that I think also, building on what Jem said, there's also a need to make sure that you're not always asking the same person in a company to represent the company, right? There's different voices within those entities that you can ask. Not unfortunately, but in our sector, very often the CEOs of these companies are still men. And so what we increasingly do is then, if there is conversations like this, just like I did with Jacinta, then you ask the female head engineer, or you ask the CFO, who's a female, to participate. And so finding different ways to make sure that the voices of those women are brought to bear is not that difficult. You just need to be really intentional about it.
Great, and I completely agree with that. And I think that that's a great time to turn to Maeve, actually. And one of the points is that when we talk about gender equality, we know that if we truly had gender equality, we would have $160 trillion growth in human capital. So this is not just only the right thing to do, it's a smart thing to do, it's a sustainable thing to do. And so as you're, in your leadership with your center and really being a place where global health diplomacy and more importantly, just diplomacy overall is an approach and strategy that you use, how do you see this application of advancing the gender equality agenda, but also the climate agenda? How can we use diplomacy, and how can the university use diplomacy as a convener in many ways and influencer as well?
Great, thank you so much. So I think I'm going to sort of say two things. One, I'm going to build off of what you said about the intentionality of engaging, people across genders. I think one issue is just the issue of research. And so research is often driven by the funders, and it is really important that the researcher speaks to the needs of those who are impacted by it. And so it can't just be for theory, but for impact. And so when we look at what are we researching, we need to engage those end-using stakeholders in what are their issues, what are the questions that they need answered, and so that the research actually responds to, I know there's a couple, you can't see it, but there's people shaking their heads, that if you're going to actually implement it, you need the stakeholders involved from day one, and that, time is short. And so so once you have those data, you can actually make a difference. And I think also on this panel, we've heard some really striking statistics, about the 4 million lives that are lost every year because of clean cook stoves, or the 160, was it trillion? Yeah. Excuse me, $1 trillion that is lost because we're not engaging women and girls across the board. And research creates data, and data drives decision making, and it drives passion, and it drives, I'm looking across the room at all these young faces who are looking at what their future careers can be. And I think having that data is really important to understand what are the most critical issues that we can change. And so that's one part. And the second part is about global health diplomacy. And health opens doors. That it is one of the strongest tools of soft power that we have. And we have to remember that when we're addressing issues that seem to be politically divisive, when we put it in terms that we all can understand, we can start to have a dialogue on the way forward. And it doesn't mean that those on the panel are not going to be advocating in what they on those issues that they see are most important, but that we all agree that we want to have a world in which our children are healthy, they are safe, they can rise to their full potential, and that our grandchildren and great-grandchildren and great-great-grandchildren get to live and with those same privileges that we do and get to swim in those same oceans with those same fish. And so part of the issue of when I think of global health diplomacy is finding a way to talk about the issues we all care about in terms that we can all move forward on. And that is one of the critical tools that we have in our belt. I'm going to turn it to
add something to that because it speaks to the heart of the kind of things that I feel like I've been doing in population health environment. I recently attended a Women Leaders in Global Health conference, and a few gender experts, and I don't consider myself a gender expert. I would love to be one someday. I get a little better every year, I hope. And they said, why do you keep using population? Isn't it so outdated? And I said, yes, it is. But at the same time, when working in this particular, I work extensively in Southern and Eastern Africa. And what I find is that you say health is a soft tool, we can use it as an entry point. Well, I find that the nexus between population and environment, just the words even, launches us into conversations, at least, that get us towards gender transformative actions at the end of the day. Now, I know that gender experts will not always agree with me, but time and time again, it has been the entry point for my partnerships with conservation groups. It continues to be. It is the entry point within local communities, even if they don't fully understand all the issues yet that we're able to bring data to and discuss. It is our entry point in addition to health. To those communities to think about the building blocks of gender, because I have found time and time again that a conversation directly about gender equality just doesn't get us very far, because people's lives are impacted by contraception and access there, by access to health services, by water and sanitation, and these issues affect women. But it doesn't really help to talk about those in theoretical terms. So I see it as a tool in gender transformative action, and I hope we can find a lot of different tools and levers that we can pull together that allow us to talk about all of these issues. And I haven't heard as much as I would like about how we bring sexual and reproductive health and rights into the same conversations, because that is also a tool.
Fantastic. And I think that point about using entry points that actually reach communities, reach people, building on the concept of diplomacy. So we're almost at a wrap, but we have to, these conversations are really meant to be two-way conversations, and we'd love to hear from you in the audience if you have any questions or if you have your own reaction that you'd like to share, but we ask you to just keep it, as I'd say, tweetable length. Great, so I see a couple hands back here. If you could please say your name and where you're from. Great, perfect. We'll begin with Sarah, please.
Hi, thank you all for such a great panel. My name is Sarah Hillware, and actually for 2.5 years, I worked on the World Bank's Clean Cooking Initiative. And so, Dimfa, it's great to see you. I'm also on the Women in Global Health Executive Committee, now working on actually universal health care. So I've worked at the intersection of both the energy poverty and healthcare access. So my question really revolves around how do we actually get political figures, and in particular those who are at the country and local levels, to keep their commitments. Because I actually did a lot of work around the recent air pollution conference, which was last year around this time. And we got many commitments from leaders around the world who were saying that they wanted to reduce air pollution by X amount by 2030, by 2050. They wanted to. They had all these ambitious goals, but now we're at a year later, and quite frankly, we haven't heard a lot from stakeholders. And so how do we hold leaders accountable who are making these commitments? How do we ensure that we're tracking, we are putting mechanisms in place, so that these very ambitious targets that we're setting actually have some accountability, because I think that's where we really need to go.
Great. Thanks, Sarah. I'm going to continue to take 2 more questions from the room. So, Arush, please.
Hi, everyone. Thank you so much for the really exciting discussion. My name is Arish Lal. I'm on the board of directors for Women in Global Health. And one of the questions I wanted to ask kind of was Jem touched upon, a few others kind of talked about, but really highlighting the fact that besides the 2 male speakers, I can count the rest of the men in this room on one hand. And I almost guarantee that if this event was called Health and Climate, there would probably be more. And so what is it about gender that is kind of making male allies not show up when they should be, especially when we are talking about the fact that we do need men to be strong supporters of women, like in terms of having them on boards and at the table. How do we make sure that male allies are showing up in the places that they need to be and hearing these conversations that are so important? And also maybe even highlighting the fact that men also have an important role to play in the movement as well, not just as empowering, but also in terms of climate change. I know you mentioned fishermen are, a big Pathfinder. You said fishermen were a big kind of partner to work with on the climate issues in Tanzania. So how are we kind of integrating men into these kind of conversations? Thank you.
Great, thanks. And then I saw a hand on this side of the room.
Hi, I'm Laura Cooper Hall, working at the Population Reference Bureau. I had a question. I wanted to thank Paul at the beginning for the opening remarks and his link that he made to the GCF and the very large climate actors in the international space. I think today we had many examples and ideas of potential project proposals that could be submitted to the GCF, and yet the GCF mentioned that they've only seen maybe 10 projects or so that have been proposed that include health considerations. I know gender is huge in their requirements for proposals, but health doesn't seem to be yet. So I'm just wondering from the panel what barriers you think there are to projects that could include health but aren't yet. What are the barriers for submitting proposals to the GCF that you have in mind? And then I also have a question to Jacinta. I was wondering, the PRB is looking for other ways to make sure gender is integrated throughout the organization, and I was wondering if a gender audit or a gender assessment internally came up within your organization. Thank you.
Great, fantastic, wonderful question. So a question about political leadership, top leadership, and really having not only commitment but accountability. We also had a question really also about male allies and gender roles and how to really have conversations about gender with that have everybody involved in it. Really specific questions about GCSF and also really at gender audit. So what I'm actually going to do is I'm going to begin with Cara, and I'm going to ask my panelists, feel free to respond to the question that you'd like to respond most to. And the challenge to the panelists at the end, make sure every question has been answered. Otherwise, well...
I get lucky, huh?
So Cara, please.
I'm going to start with the easiest one because the second one is tempting but tricky. So on the Green Climate Fund, Pathfinder is actually, to my knowledge, is the only sexual and reproductive health and rights organization to have put in an application to GCF on sexual and reproductive health and rights issues, as related to climate. it was not accepted. And I can't say we've expended a huge amount of capital on trying to do more, because frankly speaking, up until very, very recently, and I mean very recently, we really haven't seen a door opened for considerations of both health and even thinking about sexual and reproductive health, or let's just say family planning, within the scope of the health or the gender lens. And interestingly enough, I don't know whether this comes as a surprise to anyone, but there are lots of folks in the gender community who really don't even talk about reproductive health issues, because they feel that it's something where they're going to get a knee-jerk reaction, and all the good things that you get from talking about health and gender, and those who are open to it suddenly become closed to it as soon as you mention the word sexual or you mention the word voluntary family planning, and you're like, oh God, everyone's going to be scared away, so we're not going to support that. So I am extremely keen to see how we can get past that hurdle. The world would be a better place. I think we can all agree on it. Forget about the politics of mixing climate with sexual and reproductive health. How can we get there? I would love for people to put forward really bold ideas and not be afraid of the reactions we will get.
Great. So call from Cara for bold ideas. May.
So I'm going to actually respond to my former intern's question about how to get more men and boys involved. So I think this is just a problem. It's a problem across health issues. I've done a lot of work on violence against women and girls, and the engagement of men and boys is critical, but those are not often the people who are advocating most. And I think it's just naming it as an issue and bringing people into the room. It's getting men to say, this is an issue that matters to me, and of course it should matter to you. And as women, just in saying the same thing. We've also seen that just in academia, as you look at the disproportional number of women versus men who decide to get an MPH rather than an MBA. It's part of our culture, and that doesn't mean that it always has to be, but it's the reality.
Thanks, May. Sarah, please.
Yeah, so that's a great question you asked, and I think we're definitely not seeking to start from scratch. So we've actually had a gender strategy since we were founded in 2010, and one thing that we did do is essentially conduct an internal assessment of where did we see major impacts, what are the areas that we really want to build upon, and now this new redesigned strategy is essentially better optimizing the foundation that we've already built. And so I'd be happy to talk to you offline more about sort of our approach for doing that, but there's definitely a thought-out process behind sort of assessing our past work and how do we want to build on that, and what are the areas that best aligns with sort of where the direction that the Alliance is moving forward.
You'd like to skip and come back?
She wants it. I will just maybe touch on the accountability issue. Two things I would mention there. One is perhaps obvious, but data. And the good news is we're getting much better at tracking progress, whether it be on energy access, climate. So data is critical, right? That's a given. But just kind of reflecting, I was in New York last week for Unga, youth. What the youth movement has brought to the climate change agenda is enormous. There is a huge amount of power that can be brought to bear through youth to whether it's climate, health, energy access. So I think we all ought to be thinking about how what's our relationship with youth? How are we interacting with them? How can that be a two-way relationship? So that's how I would.
Fantastic. And Dimfa, would you like to say any last message?
I think the questions have been answered, but I also want to acknowledge the fact that they're very deep questions that require a whole different conversation. And so I want to acknowledge that's always hard to do at the end when you have 20 seconds left. Maybe just a plug that we will be posting a job description and are looking for a research fellow. So anybody in the audience will share it with you as well. It'll be really focused on this kind of work. So look out for that.
Great, thank you. Well, on that note, a round of applause for our panelists and our keynote. And just, this is one conversation to build on many, because there's a lot of work to be done. And it's hard to summarize the key messages here. But I'm going to ask all of us to do is really think about how we can act now. There's lots of actors that are involved in the space. There's many entry points, and we need to continue to build on that. C for collective action. Really talked about the theme of movements here in many different shapes and forms, and really thinking about how we can connect the dots. Timing, clearly an urgency, and not only an urgency to get things started, but really to focus on the unfinished agenda, and also thinking about the exit part of it too. So really timing, quite a critical issue. So act, and then the now part of it is clearly there's a nexus here. We've heard about having a shared agenda, having partnerships. There's partnership collaboration happening here just on the panelists as well. For out of the box, really challenging ourselves to not be afraid to have multidisciplinary, interdisciplinary, multisectorial, thinking about diplomacy, thinking about both internal and external ways to advance the gender equality agenda, but also the climate and health agenda, and really seeing it as one. And also the strong message about data-driven, using that data we're gaining, continuing to have more gender disaggregated data, and also engaging actors like youth. And finally, W, women. We heard that the face of energy poverty is women. Let's make sure to also add to that narrative that women are the change agents. And we heard some really inspirational stories, saw a video about it. And on that note, I'd really like to say this was a pleasure for me to be able to moderate this panel, really continue to act now. And I'd like to actually invite Nicole Shegg, who made all of this possible, and also acknowledge the many Women in Global Health DC chapter members that are in the room. You guys are, full numbers, so thank you for showing up. But also very special thanks to Maeve and the Institute here at Georgetown University for creating space for these kind of discussions. Nicole Shegg is the inaugural chair of the Women in Global Health DC chapter. She also brings 2 decades, I'd say more than that, of high-level communication, advocacy, experience, and development in global health. And she is also a co-founder of a women's consulting group called C5 Collective. And so with great pleasure, please welcome Nicole Shegg.
Thank you, Rupa. I'll be very brief. Just wanted to again thank our panelists, Paul, for coming in. We heard some buzz from the meeting he was at last week, so we wanted to add him, and we knew that he would add value today. So thank you, Paul, for joining us. For Maeve, my partner in crime, for putting this together. It's been great working with you and your team. They've been incredibly responsive, and I think we were a little bit crazy thinking, let's go to Unga and then do this right afterwards. But we need to take advantage of the moments, right? As Rupa already said, we have several of our officers in the room from the DC chapter and from our executive committee. If they can just put their hands up in the air. And Arush, you're part of that too now because you're back in DC as a global board member. So thank you all. It wouldn't be possible. And unfortunately, Victoria can't raise her hand because I have her doing the Twitter broadcast. You should have 2 things in your chair. One is from our local chapter of how to stay engaged if you're not already with us. We try to do 2 events a quarter. So we try to do something like this where we're really getting at a hot topic, a core issue, and then we try to have some fun. So we'll close out this year with maybe another event that will be more of a policy-focused event. We'll also have our holiday party. So I hope you'll be able to join us. We really think that networking, from what we've heard from all of our members, is right up there at the top. And I think from Unga last week, we all know that we program these events too much. We have too many speakers. It's always kind of the challenge of really having that time to meet new people, to talk with the people you already know, and to really figure out how we're going to collaborate and make that lasting change. So please, if you can, if you haven't already, join us on our list. The global chapter also has a postcard on your chair. We typically forward all of the information from the global chapter to the global movement. It's more than a chapter, to our DC chapter. So hopefully you'll get all that information too. And if you have any ideas for events, if your organization wants to get more involved with women in global health, please let us know. In DC, we're really taking advantage of, diplomacy, development, all of the different kind of areas and sectors we have that's very unique to this city, and that's what makes this chapter, I think, really special. So we want to really, think outside the box, think about how we can engage, ambassadors, how we can think about, things that people that we might not be talking to. They don't need to be health experts. They don't even need to be gender experts. They just want to, they should be people that want to come to the table and want to be inclusive. So that's pretty much our only criteria for engagement. So again, thank you to everyone for being here. Thank you to Maeve, and I believe there's still some lunch outside, so please help yourselves.